Hello, everyone out there. Hello, members of the Kente Club of Experts Club International. This is Janet on the Kosh TV, and today I am going to continue with the vlog that I promised on the post-operative management of the diabetic patient. Remember, information put out there are not exhaustive, okay? There are so much more information in the system, in the health system, and hospitals, depending on what their capacities are, and depending on what evidence-based practice works for them, have slight differences. They may be slight, but or very minute, but they still put so much value on these evidence-based practices and these little changes. So when you find yourself in any of these health facilities, or when you work in such areas, please make sure you are abreast with what is going on. You can find some evidence-based practices with the RCN, if you're a member of that professional body. They do come out with evidence-based practices on nursing procedures and management of conditions. Okay. I would like to say to welcome anyone who has stumbled upon this channel for the very first time, and those who follow us. I said I'm so grateful and I'm so thankful to you. I am going to continue with the topic, the post-operative management of the diabetic patient. All right, there are a few things that I would like to put out here. Oh, before I go ahead, I will say this is the Kosh TV. Okay, please remember to share, subscribe, and tell someone. Share the videos, like, comment. The comments are the ones that will actually let me or us know that we are actually doing a good work, and that's where we will be able to address some issues or some questions that you may have. All right, and my name is Janet on the Kosh TV. The post-operative management of the diabetic patient. Generally, any experienced nurse out there or health professional, experienced nurse, doctor, pharmacists even, and even nurses, doctors, pharmacists, physios, okay? Nurses, doctors, pharmacists, physios. We do know that for a good outcome of surgery, generally a good outcome of surgery includes good pain control, all right? Good pain control with good nutrition and early ambulation. Okay, general rule. Well, that's what I have observed through my years of practice. Okay, good pain control, good nutrition, and early ambulation. Okay, depending on what the surgery was, because obviously if you went for something like a lumbar removal, you would be up and about within a few minutes when you become alert, depending on what anesthesia that was given. All right, so let's keep this in mind. Good pain control, nutrition, and early ambulation. Now, we are going to talk about the diabetic. Obviously, the diabetic is that special someone. You got to think about the blood glucose level in their system, because it really plays a vital role in their recovery process. Very vital in their recovery process. So that's why maybe I seem to be talking a little bit more about it, and probably because of due to my experience in the past and still ongoing. All right. So I will be looking down because it's quite a bit, and I did make some notes, so I would have to look down a little bit more. Now, this is an important one as well. I have mentioned it somewhere. If someone did stumble upon that video, I did mention that a patient, okay, this is the general rule for diabetics, okay, type 1 diabetics or a type 2 who is now on insulin for some reason due to decision made by their health, their doctor or their health expert. If a patient is on an insulin, doctors, please listen. Doctors, nurses, please listen. If a patient, pharmacists, you can also prompt us when you notice something like this. So please listen as well. If a patient is on insulin infusion, most usually, okay, in most of the cases, the patient will be on fluids to be titrating. Okay, the patient is either going to be on the glucose infusion, that's dextrose, or normal saline. Depending on the patient's condition, there are a few variations. So where maybe these fluids may be altered a bit, and sometimes with potassium infusions, depending on what sort of patient you're dealing with. But what I do want to stress on is this: under no circumstances, okay, should you stop an insulin infusion without giving the basal insulin first. If the patient is usually on any particular type of insulin, please make sure that has been prescribed and you have given it before stopping the infusion, the insulin infusion. Always make sure you go according to the protocol. Always make sure you go according to the protocol. And the patient should not be on glucose infusion when you stop the insulin infusion. It's very important. You do not want any incident of hypoglycemia or hyperglycemia complications. So that is why we do not do this. Okay? Right. So I would continue. And let me put this out there. If there were any situation that the patient, general rule again, all right, for the diabetics, if there were any situation where the patient became hyperglycemic, okay, and you would have to give fast-acting insulin like operative. Bear this in mind. It's a rule. We know it anyway, but I stumbled upon it again and I thought I should share. The first 3-hour rule. Fast-acting, I'm reading this, fast-acting or rapid insulin begin to work 15 minutes okay, after the injection. That's subcut, we know that. So it starts working, that's the first 3-hour rule, is that it starts working 15 minutes after the injection has been given, and it peaks at about an hour. Okay, so if you do have, I know I'm not digressing, but this is something we should keep in mind. If you do have a patient who is normally on insulin, okay, there are some situations where the patient may be on oral hypoglycemic agents, and they are not due for their regular dose. Then they happen to spike hyperglycemic situation. The word isn't coming. They become hyperglycemic, then the doctor is likely, or if you're lucky to have the diabetic nurse with you, because most of them are able to prescribe medication, they prescribe the fast-acting insulin, like the operative. The 3-hour rule is that it starts to work 15 minutes after the injection has been given, and it peaks at an hour. It continues to work for 2 to 4 hours. Okay, I am saying this for a reason. Okay, it's something I came across, so I'm saying this for a reason. So it continues to peak 2 to 4 hours after it has been given. So if the patient has been given this medication, it means this is to resolve the hyperglycemic crisis at that moment. The patient is likely to continue with their regular medication. So you got to look at the time. The doctors will be doing the same thing, should be doing the same thing. When you give the insulin, you will have to monitor to make sure that it's okay for the patient to have their regular medication, their regular insulin or hypoglycemic agents. However, always, it's a good thing if you are a nurse and you are knowledgeable, you have some amount of knowledge when it comes to situations like this, but always speak with your senior. Always speak with your senior. Under no circumstances should you give their regular medication, insulin, and then give it when the time is due. We don't. That is a no-no. If the patient becomes hyperglycemic before their regular, that's if the patient is on a regular medication, okay, a regular medication in terms of the hyperglycemic agent or insulin, you do not give the regular one before the time is due, and when the time is due, you give it again. We don't do that. All right, let's just bear that in mind. Okay, I would continue. I wouldn't make this video so lengthy. If there is the need, I may have to continue some other time. Okay, so I've mentioned that. So we continue. Now, for special inputs for the post-operative patient, no, I'll leave that. No, since I've mentioned, let me just mention it. So those of us who work in the high dependency units, and every other nurse, because sometimes it comes to a point where you are taxed with the with the responsibility of looking after someone who should actually be in a high dependency unit. That's for cases like transplants, cardiac surgeries. These require special attention. So if you are in doubt of anything at all, just make sure you contact the team that operated on this patient. And the diabetic nurse should be you should be able to contact the diabetic nurse if you need them, the dietitian, because they also come in because these patients are very dependent on you, and then the doctors. All right, so bear this in mind. Those of us who work in the high dependency unit and those experienced nurses who may be taxed with the responsibility of looking after the post-operative diabetic who has had a major surgery, please make sure these people are people you can contact when you actually need them. All right, the diabetics and the dietitian and the surgeon or the surgical team that worked on the patient. Okay. Now, I didn't mention in my pre-operative management vlog that if a patient is on metformin, in circumstances, if you did not, please go back and check on it. The medication is stopped 48 hours before the surgery. Okay, it does not mean that the patient isn't monitored. The patient will be monitored. The patient will still needs to be monitored, and pardon me. And if the patient is going to, especially if the patient is going to have any procedure that requires contrast. Sometimes we do say contrast. Okay, now in situation where the patient is on metformin and that medication was stopped before the procedure, to commence the patient to restart the patient on their medication, the renal function must be checked. Okay. General rule, post-operative management. There is I'll say within the first 12 hours of post-operative management, there is the need for blood tests to be done. Okay. There is the need for blood tests to be done. So if literature and research is saying that for those patients who have been on metformin and are going to be restarted on it because they are eating, they are much more alert and they're eating quite okay for them to go back on their regular medication, their renal function to be checked, then it means this is very important. Okay, so let's bear that in mind. It is very important to get their renal function, including other blood tests, done because in cases like major surgeries like this, patient is likely to lose some amount of blood and may have had some transfusion. So we would have to do full blood count and all those using ease to make sure that the patient is on the mend. All right. Okay. Wound healing in diabetics. Diabetic patient, due to their metabolic system, are at a higher risk of delayed wound healing. And let me retake that one. Diabetics who have diabetic metabolic system, we know it's slightly different to that of the normal patient. The glucose level that has been altered in the system makes it a little bit more challenging, a little bit more work, okay, for you, the health professional, especially the nurse looking after this patient. It makes them much more prone to infections, okay? So it is very important that aseptic techniques is adhered to when you are dealing with any kind of wound, surgical wound on these patients. Okay, very important. I don't know. I think if some nurses are quite obsessed with aseptic techniques when it comes to wound healing and dealing with wounds. Okay, I'm not going to digress. Yes, it's important, especially patients who are a bit vulnerable than the normal patient. All right, so when it comes to surgical wounds and you're dealing with any patient who has had a wound, aseptic techniques must be adhered to no matter what. And for the diabetic patient, you should not compromise on it at all. Okay? Because the glucose in the system makes it attractive for the bags out there to play on the wound. So you do not want this to be happening. So you would have to adhere to strict aseptic techniques if you have to deal with the open wound. Okay? Now, I am going to write this through because I really do not want to come back to this. But I would like you to do a bit more reading. I'm going to put some links out there. Please do a bit more reading. There's something I've seen and I would like to share with you. Okay, the post-operative care. This is something from one of the hospitals out there. Make sure careful documented plan is done. Make sure that is done. Careful documented plan is done. To restart the patient on their regular medication, I have mentioned it. When the patient is able to eat and drink and it's much more alert, if the patient is on an infusion from the recovery unit, it means the patient is likely to come to you with it. So take a thorough, comprehensive handover, a thorough and a comprehensive handover from the recovery team. For the first, I'm going to share my experience with you. For the first hour to 2 hours, 30 minutes observation normally. And if the patient is on insulin infusion, hourly capillary blood glucose monitoring is advised. Okay. Obviously, the plan would have been written to you. So if you are to titrate with any other fluid, you do so appropriately and document. Okay. And I have mentioned the fact that if the patient is eating and drinking okay and is to be taken off their insulin infusion. You have to make sure the trick to this is in some institutions, they try to take the patient off the infusion at about lunchtime, or at about lunchtime when they have to have their normal insulin. So you give that insulin 30, I think it's about 30 to 60 minutes or so before you take them off, so that it flows with their regular regime of hypoglycemic medication or insulin administration. Okay. Yeah, basically that is it. It's so much that if I really want to go through everything, we would not finish. So these are just prompts and or key things that I'm trying to put out there, that if you're confronted with situations like this, make sure you know what to do. If you are in doubt, you always speak with a team. That's why we say multidisciplinary team. You always speak with a team to get clarifications, all right? Yeah. Okay. Yeah. So again, I would say let me just mention this. Patients who are likely to become fluid overload. How would you know? You would only know this if you are doing your regular observations, okay? If you are doing a regular observation. And for more experienced nurses and those nurses who are equipped with a skill of auscultation, obviously, when you listen to their chest, you should be able to tell, all right? And for the nurses who are not skilled with these, who are not equipped with these skills, you should be looking at their respirations. Are they breathless on a slight exertion, or have they become breathless since they've been in your care? The thing is this: any variation, if the patient is in your care and is getting worse, okay, there is any derangement in any of the observations, recheck and then mention it to your superior, to whoever you're working with. Let them know what this was going on, because you do not want it to get to the stage where it becomes so critical and then everyone starts running helter-skelter. Just be abreast with your, be on top with your observations, and then document and then communicate any variations or any concerns at all you may have. All right. Yeah, I have mentioned about stopping the process of stopping the insulin infusion if you have to. For patients on insulin infusion, if they have to be on it for that long, usually the first 12 hours or so, with proper management, with proper plan and care, things, and depending on the patient's condition anyway, things should be picking up. So you got to be thinking about their nutrition, their pain relief, their mobility, all right? Nutrition, a diabetic patient, you should be careful with the amount of, especially if they are on infusions as well, you should be very careful with what goes into their system. Yes. If you're not careful, there are situations where the patient may have had their normal and with a few hours later, a couple of hours later, they'll say they are hungry again, and you may be tempted to give them something that they shouldn't be having. So make sure you update your knowledge with things like this. When you have soups and stuff like that, sometimes it's much more appropriate to give those soups, healthy soups, instead of giving them something that contains the sugars and carbohydrates that will be spiking their blood glucose level. And then make you have more work on your hands than it's actually necessary. So this, and I've tried, I think I've done quite well with it, because if you go into literature and you see what it really entails, there is so much for you to understand. So I would advise again that it's really appropriate for you to be reading around these areas. If you find yourself in any institutions at all and you get the opportunity, just try and then familiarize yourself with their procedures and protocol. Again, to everyone out there, I said, remember you and your community. Okay, community could be your workplace community, the community that you interact with, are responsible for your well-being. So make sure you make a positive impact or influence wherever you are. Till I come your way again, I say stay healthy and bye-bye.